Good evening. I'm Dr. Raju, Senior Consultant in Minimal Access and General Surgery, Fortis Hospital, Banagata Road, Bengaluru. So, I'm going to speak on hernia. We all know that hernia is one of the common medical problems. Hernia is an important medical condition that affects significant number of individuals worldwide. The incidence of hernia is about 1.5 to 2% in all age group. As the age advances, the incidence of hernia also increases up to 4% at the age of 45 years. So the picture here is showing a hernia. Of course, the what is hernia? Hernia is a protrusion of tissue or organ through abdomen wall due to weakness or defect. So, what are the causes of hernia? The main causes of hernia is weakness and strain in the abdomen muscles. So these hernias could be congenital, where the hernia is present from birth, and aging effect. As the age advances, we know that the incidence of hernia also increases because of the weakness of the wall and also other underlying pathology or condition, medical conditions like respiratory problems or chronic constipation, chronic cough, or urinary obstruction, probably enlarged prostate or other urological conditions. So, other conditions like damage to the muscles from injury or previous surgery, the patients who are involved in strenuous exercise or lifting heavy weights, a chronic cough due to other respiratory problems, the commonest is COPD, the chronic obstructive airway disease that's commonly seen in chronic smokers, and chronic constipation. Usually, it is associated with other medical conditions like diabetes and advanced stage, and prostatomegaly or urethral strictures, the narrowing of the urethra or enlarged prostate in an elderly person can result in difficulty in passing urine each time they have to strain a lot during avoiding of urine. All these conditions which increases the abdominal pressure, eventually this will lead to development of hernia. The other common condition like pregnancy, especially multiple pregnancies, are the one of the main cause for hernia. The obesity or overweight and liver disease with ascites. Ascites is nothing but fluid accumulation in the abdomen cavity, which both causes increased pressure in the abdomen and weakness of the abdominal muscles, which result in hernia, especially the abdominal hernias in the umbilical area. What are the symptoms of hernia? How do they recognize? Our patients will come to know that they're having hernia. See, majority of these patients will never feel any pain or any other symptoms except the swelling or bulge, which majority will ignore because of a lack of other symptoms. So usually it appears as a lump or bulge in the abdomen region, with or without pain. And the classical symptoms of hernia is the swelling or bulge, which appears and disappears on increased intra-abdominal pressure like coughing or sneezing, straining or lifting heavy weights, or any other strenuous work. The bulge becomes more prominent, may be associated with symptoms like fullness or heaviness in the region or to severe pain. And this is the classical symptom normally the patient will experience. And when they consult a surgeon or a family doctor, will be able to diagnose. And the diagnosis can be confirmed by doing an ultrasound scan, a CT scan, and MRI, which is not routinely required. But very rarely, sometimes we may go for what is called as herniorrhaphy or diagnostic laparoscopy in a situation where small hernias in a obese patient, that's also known as occult hernias, where it is clinically very difficult to diagnose. So these hernias can be diagnosed using other special modalities like herniography or diagnostic laparoscopies. So there are various types of hernias. We are mainly talking about external hernias here today. And apart from the external hernias, the internal hernias, which we are not going to discuss today, and it's going to be a major topic. Mainly there are two types of hernias like we do come across when we heard about. I mean, when we hear about hernias, usually these are especially because of the endoscopies and other investigative modalities like CT scan of the abdomen. These diagnosis of certain internal hernias are increased nowadays. The internal areas like hiatus hernia or diaphragmatic hernias. Anyway, we are not going to discuss in detail. So today we are going to talk about only the external hernias, which is very common and can be diagnosed by patient himself. We can make out whether he has got a hernia or not, and always you can just approach the concerned specialist for the diagnosis and further management. The common type of hernias are inguinal hernia. It's mainly depending on the site which appears. The commonest site is the lower abdomen, and in the groin region, the hernia is called as inguinal hernia, whereas in the navel region, it's called umbilical hernia. And in midline upper abdomen, that's just below the chest cavity, is called epigastric hernia. On the side of the abdomen wall is called Spigelian, lumbar, and other obturator hernias. The other common type of hernias or incisional hernia, or usually the incisional hernias, which occurs near the previous surgical scar or any injury to the abdomen wall, which heals with fibrosis and giving a scar, and any hernias are arising from the region where the previous surgical scar is there or the traumatic scar. This is called as incisional hernia. So coming to the diagnosis, as already I have mentioned, the ultrasound scan is the commonest modality where we use and easily can be diagnosed. In some special cases where we are dealing with complicated hernias, we can go for a contrast CT, CT scan of the abdomen, or an MRI scan. As I mentioned earlier, very rarely we use herniogram or diagnostic laparoscopy. This is a picture showing a small defect in the anterior abdomen wall where the contents from the abdominal cavity is protruding through the abdomen wall and it is lying under the skin and fat here. Similarly, the hernia, this looks like an incisional hernia. It's in the lower abdomen. We can see the defect here and the contents are protruded through the defect and it's lying in the subcutaneous area, that means just below the skin. Coming to the treatment options, the non-surgical, usually it is not recommended, very rarely in a small asymptomatic hernias, just to postpone or to buy some time. We can follow some conservative treatment, just changing their lifestyle or modifying their lifestyle, healthy lifestyle, adopting the healthy lifestyle or some kind of exercise, avoiding lifting heavy weights or even strenuous work and any other underlying medical conditions like chronic constipation, the cough, or even any urinary problems should be corrected, and that will reduce the risk of other complications related to hernias. Coming to the surgical treatment, so there are various types of the procedures normally explained to correct the hernia or to repair the hernias. Depending on the type of hernia, the size of the hernia, and the patient's conditions or comorbidities, available facilities. The surgeon will decide the type of repair or surgery. The open, which is commonly used in most of the hernia repair, and then the laparoscopy, the second most popular procedures for hernia repair. And very rarely we can use, if the facility is available, robotic surgeries. So the picture showing, couple of post-operative patients with in open case, a small incision just above, in case of inguinal hernia, incision just above the groin. And similarly, in laparoscopy, very small, it's like puncture holes or 5 millimeter or 10 millimeter small keyholes. And these are the few incisions in laparoscopic on the right side, what we are seeing. So, in both the cases, whether it is open or laparoscopy, we use a processes called a synthetic mesh made of polypropylene, which is non-absorbable, meant to stay in tissues, and gradually it incorporate with the other layer of tissues. So what happens if the hernia is left untreated? So usually neglected hernias can cause incarceration. This is nothing but the adhesions. It forms the adhesions. The hernia, which the part of the viscera or the tissue which has come out of the abdominal cavity and which lies in under the skin, which forms adhesion. Normally, these hernias are reducible when they lie down or the pressure comes down. Either it reduces or it goes back into their original cavity spontaneously, or with little effort, or where we may have to push the content back into the abdomen cavity. So this is called, the manual reduction. So this manual reduction or even the spontaneous reduction will be absent in case of incarcerated hernias, where adhesions will form. The structures which come out of the abdomen will form dense adhesions inside under the skin, and which fails to reduce spontaneously or with manual reduction. Eventually, this the part of the intestine which is there present inside the sac can cause obstruction. So the when there is intestinal obstruction, the patient will develop sudden and severe onset of abdominal pain with uh, abdominal bloating or distension of the abdomen with vomiting and constipation, and eventually they may require emergency operation. If this is neglected, even after obstruction, the portion of the intestine or a loop of intestine which is stuck in the hernial sac can go for rotation, or the blood circulation to the loop of the intestine will be cut off. That's called a strangulated hernia. This is something major and dangerous complication of hernia, and if neglected, can lead to sepsis and gangrene of the bowel and then sepsis. Eventually, it can lead to death if untreated. So, can a pregnant woman undergo hernia? This is one of the common questions, and majority will notice hernia during pregnancy. Either it will be noticed by their gynecologist or doctors, or during scanning will be detected. These hernias usually, if it is asymptomatic, and we never recommend any surgical intervention during pregnancy. If at all, if there is any emergency or if there is an obstruction, then we can take a risk and go ahead. And we normally avoid using a process or using a mesh during hernia repair. It is what is called as anatomical repair, just approximating the defect after releasing. It's only in case of emergency, and compared to the first and last trimester, the second trimester is uh, better. In case of during second trimester, if the hernia is symptomatic or if it is not really bothering much, it can be, the surgery can be avoided in these patients and can be considered surgery after 1 year of completing the pregnancy. That's an ideal time. Or suppose in young patient where the hernia is diagnosed prior to pregnancy, if they are planning to conceive, then it's always better after the surgery, hernia surgery, they can wait for 1 to 3 years depending on the type of hernia and the type of surgery undergone. It's better to wait at least for a year or 1 to 3 years after the surgery before they conceive. So, coming to the prevention or even to avoid some of the risk factors which are involved in aggravating the hernia development, or maintaining a healthy lifestyle where we can adopting a healthy lifestyle will prevent or reduce the risk of hernia, like doing a healthy adequate exercise to strengthen the abdomen muscles, and maintaining a healthy body weight, eating a balanced diet, including consumption of high fiber in the diet, so to avoid constipation, and adopting a proper lifting technique. This is the one where people who are involved in lifting heavy weights can adopt, proper techniques in lifting heavy weights, can avoid or prevent hernia development. Similarly, the if possible, to avoid the strenuous work, and these are the few points where they can, consider and to postpone or to avoid certain complications involved with the hernias can be prevented. To conclude, the hernias are common medical conditions that can significantly impact an individual's quality of life. Early detection and timely intervention or surgery can prevent complications. The early detection and timely intervention or surgery can prevent complications related to hernias, which I already mentioned about the strangulated hernias or obstructed hernias. These complications can be avoided, or still, I mean, the hernia, which even after correction of hernias, there are possible like patients can come back with some recurrence, and about the best of the hospital has about 1% of recurrence rate, and when it is done by an experienced surgeon, the chance of recurrence of hernia is less than 1%. Again, this recurrence rate depends on the type of hernia, the size of the hernia, and the complexity of the hernia, and the materials used, and type of repair we used. All this matters along with the patient's factors. Patient's factors includes, as I already mentioned, the uh, the chronic cough or constipation and urinary problems, along with liver disease with ascites. These are the main few things, and also the overall general condition of the patient. So these are the few things which contribute for the recurrence. Yeah, I have a question. Do hernias cause constipation? So rather than this other way around, where constipation can lead to hernias, but rarely, as I mentioned earlier, the obstructed hernias, where it's partially obstructed, or the intestinal loop which was stuck in the hernial sac, and partial obstruction to the intestine can cause constipation. Okay, I have another question. When can I go back to work after hernia surgery? So normally we recommend, again, this is depending on the type of hernia and the repair what we have done, and also other various patient's factors. So normally we recommend 1 week of restricted activities and only essential things for initially, and after that the 1 month they can do the normal activities to avoid the strenuous work. For example, any exercise or other activities like yoga, cycling, swimming, brisk walk, and jogging to be avoided initially for 1 month. So after that, slowly they can get back to their routine activities. The third question: why is mesh used in hernia surgery? So to avoid the recurrence rate, so in spite of doing all different varieties, the various procedures have been explained earlier, and for ages they have tried and using the processes where using a mesh or any other process will reduce the tension on the suture line, and this will prevent recurrence rate. So when we use a mesh, it reinforces the abdomen wall, and also it reduces the tension on the abdomen muscle. So hence the recurrence rate will be very less. I think this question I already mentioned hernia with pregnancy. So when it is asymptomatic and if it is not causing any complication or if it is not having any other life-threatening complication, always we can wait and watch. And after completing the pregnancy, surgery can be considered after 1 year after completing the pregnancy. That's number one. Suppose if they're planning for to conceive the second baby or third baby, then it is always better to postpone surgery, hernia surgery. And once they complete the pregnancies, then they can consider going for surgery after 1 year at least, minimum 1 year of completing the pregnancy. The most common kind of hernias is inguinal hernia. The next is incisional hernia. The next common is umbilical hernia. Hernia surgeries are not really very serious major operations, but when we consider patients' other comorbidities, so for example, patient having other medical problems, maybe for example, a liver disease with ascites is going to be a high risk, or even other conditions like the heart related or any other abdominal conditions. See, when the surgery, in the complex hernia, the surgery can become a major surgery. In a simple, straightforward hernias, usually it is a simple surgery, and majority will recover without much problem. The causes of hernia already I've discussed, and usually the increased intra-abdominal pressure or strain on the abdomen muscles. It may be weak or defective muscles, and that's the main cause. The causes for strain are strenuous exercise, lifting heavy weights, or repeated pregnancies, or even advanced stage, chronic constipation, chronic cough, and any urinary problems like enlarged prostate or urethral strictures. And these are the few conditions where the patient will have increased pressure in the abdomen cavity, which try to push the contents through the weak muscles or defected areas. So the different types of surgical procedures is open surgery, where we make an incision to open the hernia sac and reduce the content, close the defect, and over that we place a mesh and to reinforce the defect, and then we close the wound in layers with or without drain. That is an open method. Whereas in surgical laparoscopy, we make a keyhole and with a 5 millimeter or 10 millimeter size small hollow tubes are placed into the abdomen, and through this we use other instruments to operate to for dissection and to reduce the hernia and to placing the mesh and also to fix the mesh in position. So ultimately, the results are the scar will be less in laparoscopy compared to the open surgery, and also the recovery will be faster compared to the open surgery. The robotic hernia is uh, the advantage of robotic hernia is if the facility is available in a complex hernias where it requires meticulous dissection or more of suturing, and definitely it makes it is more accurate and very precise and with less post-operative pain and faster recovery. The complications when we talk about the complications of hernia, like any surgeries anywhere in the world, so the three the common complications are uh, the bleeding, infection, and pain. These are the three common for any surgeries anywhere in the world. Apart from that, when we are talking about hernia, then hernia related other common is the seroma formation or fluid accumulation in the cavity, and the recurrence is what I mentioned earlier. It's a late complication of hernia repair. The recurrence is the other one. There are various factors involved in this, already mentioned about patient factor, and also the type of the technique is also important, equally important, and whether it's used with or without mesh. Mesh is used in most of the hernia repairs, but very rarely, as I mentioned earlier, certain situation where we may not use the mesh when we are suspecting a little bit of infection or mild contamination. Those situations we may have to avoid using any process or foreign material to avoid infections. In those cases, chance of recurrence will be there. And apart from other infection, recurrence, and bleeding, pain, so the nerve injury or entrapment of nerves, certain nerves comes in the area which can be entrapped inside the sutures, can cause groin pain. It may be a chronic, mild to moderate, or sometimes very rarely it can become severe in some patients. It may be, for a couple of weeks to months and gradually will subside. Very rarely they may require some intervention. Otherwise, majority will settle down without any, with only some painkillers. In summary, the hernias are major uh, concern. The and only thing diagnosing early or early detection and treatment can prevent for the complications of hernias.